Patriots, Dr. Betsy Eads here today. It's Thursday in sunny Florida. So it's come to my attention that in Malaysia, the first physician was put to death under the Nuremburg codes for giving the bioweapon vaccine and killing a patient. Now this sets a humongous precedence for the rest of the world, the rest of the nations. And it should send a tremendous signal out to nurses, doctors, and hospital staff that you can't run and hide from this anymore. There is plenty of VAERS data out there of deaths, permanent disability, and harm. There's plenty of DMED military data out there of deaths, disabilities, and harm. We now know that doctors are reimbursed hundreds of thousands of dollars to give these bioweapon vaccines. Doctors and hospitals are reimbursed up to $400,000 to give the killer combination of remdesivir and ventilation, as well as sedation, causing death. I implore the nursing staff, doctors, pharmacists, hospital staff to cease and desist and start speaking out. You know people are dying from the CDC cocktail in the hospital. You know people are dying from the bioweapon vaccines. You need to stop what you're doing. If you have to quit that job and walk away, walk away. These are crimes against humanity. You cannot run, you cannot hide, you will not be able to walk down the street. Nuremberg-like tribunals have started. Whether you're a doctor, a nurse, a pharmacist, a CNA, a lab tech, anyone participating in giving these bioweapon jabs or killing a patient. That includes school headmasters. That includes principals. That includes anywhere where somebody was forced to take an experimental medication without informed consent, or a CDC cocktail including ventilation or CDC without consent. Appropriate consent. I'm not talking about written consent. I'm talking about appropriate medical consent, including what ingredients they're being given, what the side effects of the product are, and what studies have been done to prove the efficacy of the product. Because we know the vaccines are bioweapons. They are lipid nanotubes or nano Q dot spot, graphene oxide, which are killing patients. We know remdesivir killed 53% of the patients in the Ebola study. All of this is readily available to nurses, doctors, pharmacists, and healthcare workers all over the world. There is no excuse for continuing to push the bioweapon shots, remdesivir, and ventilation on people. There is no reason to push a fraudulent PCR antigen test, which is doing nothing but collecting genetic material to be passed on for cloning. Please, I implore you to cease and desist what you're doing, nurses, pharmacists, doctors. Walk away if you have to walk away. Repent. Ask for forgiveness. Because if you don't, God will find you. The military will find you. And you will suffer the same death that this Malaysian doctor suffered. And you will deserve it. God bless everybody.